Good afternoon. My name is Sarah Steensma. I am a family support specialist with Ask Resource Center, and I'll be hosting this webinar. This is Iowa Medicaid Unwind, and with us today we have Renee Wegworth and Jeremy Smith. So Ask Resource Center is welcome to present both Renee Wegworth and Jeremy Smith. I'm going to do a little introduction of both of them. Renee is a health insurance specialist and outreach specialist with the Center for Medicare and Medicaid Services within the local engagement and administration's regional office in Kansas City, Missouri. Jeremy Smith has worked for First Choice Services since September of 2015. He serves as the program director for its CMS-funded Navigator grants for the state of Iowa, New Hampshire, West Virginia, and Montana. So I'm going to go ahead. We're going to start with Renee. She will share her slideshow and we'll pause and do any questions related to the material that she has shared. Then we'll move on to Jeremy and then do the same. And then at the end, I will share just some Iowa specific information if it has not been covered.
Before I begin, we always start with our disclaimers. This PowerPoint was current at the time of presentation, but policy regarding CMS programs is subject to change. The contents of this document do not have the force and effect of law and are not meant to bind the public in any way, unless specifically incorporated into a contract. This document is intended only to provide clarity to the public regarding existing requirements under the law. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense. And just to also let you know, Health Insurance Marketplace is a registered service mark of the U.S. Department of Health and Human Services. So we always have to start out with our disclaimer. So good afternoon. My name is Renee Wegworth. I am a health insurance specialist and outreach specialist at the Kansas City Regional Office of CMS. It's a pleasure to join you today to speak a little about the end of the Medicaid continuous enrollment condition and what that means for people enrolled in Medicaid and children's health insurance programs, otherwise known as CHIP, as we return to normal operations. Since March of 2020, as a condition of receiving an increased federal matching rate, states have been required to maintain enrollment of nearly all Medicaid enrollees. Now that continuous coverage requirement has expired, states have up to 12 months to return to normal eligibility and enrollment operations, including disenrolling ineligible individuals. This process has commonly been referred to as unwinding. Under the Consolidated Appropriations Act of 2023, the continuous enrollment condition ended on March 31st, 2023. As of April 1st of 2023, states began terminating Medicaid enrollment for individuals no longer eligible. We at HHS and CMS are dedicated to making sure that people stay connected to coverage, whether that is remaining on Medicaid or CHIP if they are still eligible, or transitioning to another coverage option such as marketplace coverage. Since many people enrolled in Medicaid and CHIP have not had to complete a full renewal process in nearly 3 years, if ever, we want to make sure that people enrolled in Medicaid and CHIP are aware that this is coming and to make sure that your state agency has their updated contact information so they can be reached when their state begins reaching out to beneficiaries, which I believe the state of Iowa, this has already been occurring. Medicaid and Children's Health Insurance Program, or CHIP, provided essential health coverage to millions of people during the COVID-19 pandemic. As of March 2023, more than 93 million people were enrolled in Medicaid and CHIP. States are now resuming their regular processes for renewing individuals' Medicaid coverage. Before the COVID-19 pandemic, people frequently transitioned between different types of coverage. Some lost coverage because they were no longer eligible, others due to administrative reasons, such as not returning required paperwork on time, often referred to as red tape. As states resume regular renewal processes now, the Centers for Medicare and Medicaid Services aims to ensure that all eligible people can keep their coverage or find another source of coverage, whether that's through their employer, the marketplace, or another source. Each year, Medicaid coverage must be renewed. However, during COVID, people with Medicaid and Children's Health Insurance Program didn't have to worry about renewing their coverage because the public health emergency paused renewals to ensure that as many people as possible stay covered during the pandemic. This was referred to as continuous enrollment condition. The continuous enrollment condition ended on March 31st. The Omnibus Bill, also known as the Consolidated Appropriations Act, or CAA 2023, that passed and was enacted in December of 2022, said that the FFCRA continuous enrollment condition ends on March 31st. With the end of the continuous enrollment condition, states have begun the process of unwinding or returning to normal Medicaid or CHIP operations. That includes restarting full Medicaid and CHIP eligibility renewals, and for Medicaid, disenrolling individuals who are no longer eligible. Because the continuous enrollment condition ended on March 31st, states started terminating Medicaid enrollment for individuals they identify as no longer eligible as of April 1st, 2023. This work requires a significant amount of work on states' part. Researchers have estimated that nearly 15 million enrollees could lose their Medicaid or CHIP coverage as states resume normal renewals and redetermination processes. However, it is important to note that these estimates do not represent the number of people who are likely to become uninsured. The central goal for unwinding is to ensure that people who remain eligible for Medicaid and CHIP can retain their coverage, and those who are not able to transition to other affordable coverage options through the marketplace, Medicare, employer-sponsored coverage, or other insurance. So what are states expected to do? In returning to normal operations, everyone with Medicaid or CHIP coverage will need to renew their coverage between now and the middle of 2024. States have also been preparing for this process for over a year now to ensure that eligible individuals can retain coverage and to make sure people who are eligible for other programs transition effectively. The Biden and Harris administration is committed to maximizing the number of people with affordable, high-quality coverage. We want to make sure people stay covered, whether that's through Medicaid, Medicare, or the marketplace, or employer-sponsored coverage. Since day one, we have worked to do everything in our power to keep people covered, including working with states to make Medicaid renewals simpler for consumers and auto-renewing coverage for eligible people, and to make it easier to make low or no cost coverage in the marketplace. I just talked about general timeliness for initiating renewals, but it's also important to remember that the renewal process, or what the renewal process entails. Generally, states need to renew eligibility for everyone in their Medicaid and CHIP programs once every 12 months for MAGI beneficiaries. When I say MAGI, I refer to populations enrolled based on modified adjusted gross income, including most children, parents, pregnant individuals, and other non-disabled. States must renew eligibility at least once every 12 months for non-MAGI beneficiary. These include individuals who are over 65, as well as those with blindness or disabilities. States must first attempt to renew eligibility for appropriate populations based on information available to the state without asking for documentation. That is referred to as an ex parte renewal, also called auto renewal, passive renewal, or administrative renewal. If someone can be redetermined eligible based on available information, the state must send a notice letting them know that they are still eligible and requesting any corrections or updates if needed. If a state attempts an ex parte renewal and cannot find a person eligible that way, the state must send a renewal form to request needed information. For individuals enrolled on a MAGI basis, so most children and non-disabled adults, the state must provide a minimum of 30 days to return the form. Lastly, if the Medicaid agency determines an individual is ineligible for Medicaid, it must screen them for eligibility for other programs and transfer their information to the appropriate program. Many children may be transferred to CHIP Individuals may also be transferred to the marketplace for determination. CMS has worked extensively with state Medicaid agencies to provide guidance on federal requirements, develop an array of tools and strategies for states to simplify and make Medicaid renewals easier for people, and troubleshoot operational issues. Nearly half of states have newly adopted strategies to renew eligibility based on information from other programs, like the Supplemental Nutrition Assistance Program, otherwise known as SNAP, minimizing the need for families to provide duplicate information to Medicaid agencies to retain their benefits. Over 40 states are using information from Medicaid managed care organizations or other databases to obtain updated contact information for individuals and help ensure their renewal letters are received. Over two-thirds of states have adopted their strategies to renew Medicaid for eligible families without requesting additional paperwork. We continue to encourage all states to take up all the relevant strategies CMS has put on the table that simplify the Medicaid renewal process and make it easier for eligible individuals to renew their coverage. We're calling on states, members of Congress, the healthcare industry, community organizations, advocacy coalitions, and other public and private partners to do everything in their power to help people stay covered. You'll see here are the 4 main messages we want to make sure people enrolled in Medicaid and CHIP know about. First, update your contact information with your state Medicaid or CHIP agency. Second, respond to the Medicaid or CHIP renewal form when it arrives to keep your coverage. Third, parents especially should make sure you respond. Even if you don't think you are eligible, your kids could still be eligible. Fourth, consider other coverage options if you are no longer eligible for Medicaid or CHIP, such as employer-sponsored insurance coverage through the health insurance marketplace, or transitioning to Medicare if you are eligible. Now I'm going to transition a little bit and talk a little bit about the federally facilitated marketplace, otherwise known as FFM, and do a little overview of the processes and updates on plans for Medicaid unwinding. First, for those of you who are less familiar with the marketplaces, I wanted to highlight a few key points. In most states, the federal government runs the marketplace, sometimes known as the exchange, for individuals and families, or allows a state-run marketplace to use the federal platform, known as Marketplace or FFM. It's found online at healthcare.gov. Some states run their own marketplaces at different websites, and CMS works in close partnership with those states as well. Now on to Medicaid to marketplace transitions. The FFM receives information via secure electronic file known as inbound account transfer from state Medicaid and CHIP agencies for individuals who newly apply for Medicaid or CHIP at the state agency and are found ineligible, and individuals who are enrolled in Medicaid or CHIP and found ineligible following a full redetermination by the state agency. Now, for a little more information on the inbound account transfer process from the consumer perspective, when the federally facilitated marketplace receives the inbound account transfer, a paper notice is mailed to the consumer with instructions on how to apply for marketplace coverage. Individuals do not need to wait to receive this notice to apply for marketplace coverage. If an individual receives notice from their state or Medicaid CHIP agency that they have been denied or terminated from Medicaid or CHIP, they are encouraged to immediately come to healthcare.gov to apply for coverages. The marketplace has ramped up consumer communications for individuals losing Medicaid or CHIP for the unwinding period. The marketplace uses a variety of methods to contact consumers who have lost Medicaid or CHIP and provide education outreach to bring them into the marketplace. In addition to the notices and letters sent to consumers, including initial inbound account transfer notice discussed on the previous slide, the marketplace contacts consumers via email, audio dial calls, and text messages when those means of contact are available. Where possible, some consumers will also receive direct outreach through marketplace federally certified navigators and assisters if they do not secure other coverage. These communications involve reminding consumers of the steps they need to take to enroll in coverage, where to get assistance, the availability of the SEP, and deadlines they need to be aware of when applying for coverage. Now, on to a little more detail on the marketplace enrollment. First, I want to note that everyone can apply for federal marketplace coverage during open enrollment, which occurs annually from November 1st through January 15th. Outside of open enrollment, individuals may qualify for a special enrollment period, otherwise known as SEP, if they experience a qualifying life event such as losing their health coverage. To ensure consumers have sufficient time to enroll in marketplace coverage during the unwinding period, consumers who lose Medicaid and CHIP coverage between March 31st of 2023 and July 31st of 2024 will be eligible for a continuous SEP beginning the day they submit or update a marketplace application. Consumers can access the unwinding SEP by submitting or updating an application through the healthcare.gov, a certified partner that supports SEPs, or the Marketplace Call Center. Consumers who are determined eligible for this unwinding SEP will have 60 days from the date on which they submit a new or updated healthcare.gov application to make a plan selection. If anyone has questions on this SEP, we recommend reviewing the FAQs, which is linked at this website. CMS recommends that Medicaid and CHIP beneficiaries submit or update an application on healthcare.gov as soon as they receive their Medicaid and CHIP termination letter from their state. Individuals do not need to wait to receive a notice from the marketplace to apply for coverage. For individuals who need additional assistance in enrolling in coverage, navigators or other assistant personnel are great resources. Federally facilitated marketplace assisters, which include navigators and certified application counselors, provide free, unbiased enrollment assistance and play a vital role in helping consumers prepare applications to determine eligibility for and enroll in coverage through the marketplace and insurance affordability programs. Assisters operate year-round, increasing awareness among the uninsured about the coverage options available to them, helping consumers find affordable coverage that meets their needs, and assisting consumers to ensure they are equipped with the tools and resources needed to utilize and maintain their health coverage all year. In August, as part of a historic investment in the Navigator program, the FFM released additional funding for Navigator grantees to facilitate direct consumer outreach, education, and enrollment activities necessary to ensure seamless transitions into the market coverage. Assisters in FFM states are also receiving unwinding specific training, guidance, and resources, in addition to other programmatic support geared towards fortifying consumer assistance best practices for Medicaid and marketplace populations. Consumers can find assistance from navigators and other assistance personnel in their area on Find Local Help. In addition to navigators and sisters, CMS is partnering with health insurance plans, providing guidance, and promoting key strategies for both Medicaid managed care organizations, or MCOs, and marketplace qualified health plans, QHPs, to ensure they take the necessary steps and have the tools to assist consumers during unwinding. More information on these strategies can be found on the Medicaid.gov/unwinding page. Licensed agents and brokers also play a key role by providing consumers with expert guidance on applying for marketplace coverage and insurance affordability programs and helping consumers compare plan options. Additionally, agents and brokers assist customers with maintaining their coverage year-round, extending beyond initial application and enrollment. Unlike navigators and other assisters, agents and brokers earn a commission from their enrollments of consumers in a marketplace health plans, and state regulations allow them to make specific plan recommendations. Marketplace registered agents and brokers are well positioned to assist consumers during unwinding and are receiving regular updates and resources on how to best assist these consumers. Consumers can find assistance from agents and brokers in their area at the link provided. In a summary, I want to highlight how individuals can get help completing a marketplace application. They can visit healthcare.gov, which will direct individuals to their state-based marketplace website as applicable. You can also call the Marketplace Call Center at 1-800-318-2596 or visit localhelp.healthcare.gov to make an appointment with someone in their area who can help. Thank you again for letting me attend this session. We appreciate your time. If you have any comments or feedback on my presentation today, please don't hesitate to use the QR code or use the link and you can fill out an evaluation. But now I will turn it on over to my Jeremy. Let me stop sharing.
All right, thank you, Renee. Let me go ahead and get my presentation up here for you. All right, so first off, thanks for having me out today. My name is Jeremy Smith. I'm the program director for the Iowa Navigator program. And so I just wanted to go over a little bit more detail on kind of a lot of the things that Renee has already touched on. And I'll be having our contact information up at several points throughout the presentation. But really, you know, Renee's kind of done a really great job of talking about the different insurance options that are available to folks that live in Iowa. Just to kind of recap, you know, we've got the Medicaid program, we have the CHIP program for kids, also known as Hawkeye. We have the plans on the health insurance marketplace. And then, of course, if you offered insurance through your job, you have that option as well. So just before we get started, a little bit more background on the organization that I work for, which is First Choice Services. We specialize in social service and behavioral health helplines. So we got our start a long time ago when we started operating the gambling addiction helpline for West Virginia. And then from there, we've just kind of expanded pretty rapidly. We do addiction and mental health helplines. We help answer the 988 suicide prevention lifelines for West Virginia, but also for across the whole country. We do chats and texts for 988. We help answer 211 calls with United Ways. And then we operate these Navigator grants that we wanted to talk a little bit more about today. We got our start in 2015. We started doing it in West Virginia. And then in 2019, we noticed that in certain states, there was no organizations that wanted to do Navigator work anymore. So we went ahead and we applied and was selected to also do the work in Iowa, New Hampshire, and Montana as well. So it's a really great program. If you're not familiar, a Navigator is a free grant-funded program to anybody that lives in Iowa to be able to help you figure out, you know, if you qualify for CHIP or Medicaid or the plans on the health insurance marketplace. And then, of course, we can help you do the application as well. So if you're trying to figure out what you qualify for, if you have questions about plans, or if you need an application enrollment assistance, a Navigator can talk to you about all those things and provide free assistance as long as you live in Iowa. So like I said, we're the Navigator organization for a few states, but we've been doing it in Iowa. We first started it in late 2018. We have been able to expand the program pretty significantly over the last few years. Renee touched on it, but the funding for Navigators have increased pretty significantly. So in 2021, we was actually selected for a 3-year renewal, and we just started year 3 of that 3-year project. And we've been able to do a lot of great work with the extra funding. It allowed us to bring on more navigators to provide more assistance. And then we was also able to bring in some Spanish speaking navigators that work with us full time, so that if somebody calls, we can assist in English and Spanish. And then, of course, we also have a language translation line if somebody wants to call and receive help in a language other than English and Spanish. So, like Renee was mentioning, this is a really important time for people to pay attention to health insurance for a couple different reasons. And the health insurance marketplace, this is the platform that navigators use the most. It really does do a great job of assisting people figure out, if they're eligible for a marketplace plan. It also can help you figure out what the pricing will be, and also if you qualify for the advanced premium tax credit. And what that means is that's a monthly subsidy that can help you pay for the plan that you've picked out on the marketplace. And by doing a marketplace application, you can see if you qualify for those subsidies, and you can get an idea of about what the plans might cost you and your family. And over the last couple years, there's been some pretty significant increases in who can qualify for the marketplace, and also how much of a subsidy you may qualify for. And what we're seeing is families are just super excited for the pricing that they're seeing for the marketplace plans right now. So in order to offer a plan and look at the plans on the different on the marketplace, there's 3 different levels of plans that the carriers offer. There's bronze plans, silver plans, and gold plans. And so your gold plans are going to be like your 80-20 plans usually, silver at your 70-30, and then your bronze at 60-40. And then what makes the marketplace nice and kind of a relief for a lot of folks is, in order to have a plan that you're shopping for on the marketplace, the carrier offering plans, they have to be in good standing with the state and the feds. They all have to cover essential health benefits. So that means they can't pick and choose what they want to cover when they offer health insurance. If they offer a plan on the marketplace, it has to at least offer those essential health benefits. The carrier has to offer at least 1 silver and 1 gold plan. And then also they have to offer the same price, whether it's an on the marketplace plan or an off the marketplace plan. Just a little bit more information about the essential health benefits. So like I mentioned, if you're offering a plan on the marketplace, it has to cover at least these essential health benefits listed here. So things like hospitalization, emergency room care, lab tests, prescriptions, preventative services, and more. So it makes it really nice that when you're shopping for a plan on the marketplace, you have the peace of mind of at least knowing that all the plans offer these things. A little bit more information, because this is super important as well. All of the plans that is on the marketplace, they have to cover what we call preventative health care, and that's going to be at no charge to you. So if you select a plan on the marketplace, all of them cover with this, they automatically cover the free preventative care that come along with buying any of these plans. So these are things going to be like your yearly exams, immunizations, and then a lot of certain screenings based on your family history or your age, and these things are going to be covered at no cost. So just to recap a little bit on who's eligible to be able to shop for a plan on the marketplace, you must live in the United States and be served by a state that uses the marketplace, which Iowa, of course, is. You have to be a U.S. citizen, U.S. national, or lawfully present, and not be incarcerated currently. All right, so I want to talk just a little bit more on the advanced premium tax credit, because this tends to be one of the most misunderstood parts of being able to get a plan on the health insurance marketplace. So first off, if you're not eligible for a source of other qualifying coverage, that's going to be one of the first things that you need to look at in order to see if you qualify for the advanced premium tax credit. And so what that means is if you're not eligible for Medicare, Medicaid, the CHIP program, or a plan that's available through your job or a spouse's job, that's when you may want to look at a marketplace plan and see if you're eligible for that monthly subsidy. And then, of course, the amount that you may qualify for, it's based on your age, income, and your family size. There's been a lot of changes with this, and more people than ever can qualify. And we've seen a lot of people be really happy with the prices after they're eligible for this advanced premium tax credit that helps pay for the plan that you picked out. The other type of financial assistance you may get if you're shopping for a plan on the marketplace is called cost sharing reductions. And so what that means is that if you're below 250% of the federal poverty level, you may be eligible for additional financial assistance to immediately lower the cost of your deductibles, co-pays, and co-insurance. So, this is a huge help for folks that's under 250% of the poverty level and then shopping for a plan on the marketplace. The thing is you just have to make sure you're looking at the silver plans in order to be eligible for this cost sharing. All right, so we talked about this a little bit, but it's always good to recap and go over it again. The annual open enrollment period for the marketplace plans is going to be from November 1st to January 15th. And so anybody that currently has a marketplace plan and needs to maybe re-enroll or change plans, or anybody that needs to sign up for the first time, you need to make sure you're looking at doing it during this open enrollment period. And so for anybody that enrolls between November 1st and December 15th, your plan would start on January 1st. And then anybody that signs up between December 16th until January 15th, your plan would start on February 1st. So for folks that are uninsured, need to figure out what they may qualify for, it's really important that you pay attention to these open enrollment periods, because if you miss it, you may not be able to get coverage again until 2025. And the exception to that is if you would happen to qualify for a special enrollment period. And so a special enrollment period, anytime you lose current coverage, that's generally going to give you a special enrollment period of 60 days. And then also changes in your household. So marriage, adding a dependent, divorce, things like that. You also may want to look into a special enrollment period in those circumstances as well. So this is also a little redundant. Renee did a wonderful job of talking to us about what's going on with Medicaid right now. And so just to recap, during the pandemic, people were, if they got on Medicaid, they was allowed to stay on it without doing an annual renewal like it used to be. Now that the pandemic is over, everybody's kind of going back to those original rules that were in place, that you need to make sure you do your renewal each year in order to keep Medicaid and make sure you still qualify. So it's really important that you make sure that your address and all of your contact information is up to date with the Medicaid office so that you can get all the information you're going to need to do your renewal. And then, of course, if you do happen to lose Medicaid, you can qualify for that special enrollment period that's going to be in effect clear until through June of 2024. So if you lose Medicaid, you can look into that special enrollment period clearing through next summer. So really important, if you know anybody that's lost Medicaid, or if you have yourself, definitely look into the special enrollment period through the marketplace. Lastly, if you've lost Medicaid, check with your employer to see about a special enrollment period as well. In a lot of cases, if you're offered insurance through your job and you've lost Medicaid, you should approach your HR department and see if you're offered insurance through the job, and see about a special enrollment period through your employer as well. One of the other things that I really wanted to update everybody on is some of the changes that's occurred through the marketplace over the last couple years. One of the major changes that's benefited a lot of families is something that we've called it's a fix to the family glitch, is what we've always called it. And what that means is, if somebody is married and their spouse's job offers them insurance, it used to be that if they offered you insurance through your spouse's job, in most cases that knocked you out of being able to get the advanced premium tax credit on the marketplace, and you couldn't qualify for any subsidies to make the plans more affordable. What they have done is they've updated this to where there's now an affordability test. So that if you're offered insurance through your spouse's job and it's deemed unaffordable, you can opt out of the employer-sponsored coverage and you can look at a plan on the marketplace with subsidies. So I'm really encouraging families to look at this new option, because over the last year, we've had a lot of happy people be able to get insurance on the marketplace for the first time at a very affordable rate, thanks to these new rules. All right, just a quick recap on the plans that's offered in Iowa through the marketplace. So we have 3 companies. We have Oscar, Wellmark, and Medica. And Medica and Wellmark, they will offer it for the 2024 plan year. They'll be offering plans in all 99 counties. And then Oscar will serve and have plans in 75 counties in Iowa. So a lot of really great carriers offering a variety of plans. We really encourage everybody to check out what they're offering. We've talked a little bit about Medicaid and CHIP already, also known as Hawkeye. But if you're not familiar, for kids, I mean, you can make up to 300% of the federal poverty level and still be looking at eligibility for CHIP. And then, of course, through Medicaid, you can make up to 138% of the federal poverty level and be looking at Medicaid. So couple different ways you can apply. Healthcare.gov is going to screen you for Medicaid and CHIP if you do a marketplace application. And then also, if you want to go directly through your Medicaid agency, you can do that as well. And then, of course, as navigators, we're here to assist you with the applications if anybody needs help. So if anybody is interested in receiving help from the navigators, we have open availability right now. People can call. We are in from 7 a.m. until 5 p.m. And you can call and we can book an appointment with you. We can go over what your options are. You're just going to need, a list of your medications, a list of your doctors, so that we can help you figure out if the plan you're looking at, if it has your doctors are in network, if your medicines are going to be covered. And then you'll need an idea of your yearly income for 2024 if you're looking at a marketplace application, and then birth dates and social security numbers for yourself and everybody in your family. So once again, if you're looking for health insurance, the Medicaid program, CHIP for kids, the marketplace on healthcare.gov, and then of course check with your employer and see if there's an offer of coverage from there. Those are going to be a lot of the options that people's going to run into. If you're interested in helping us get the word out about open enrollment and the assistance navigators can provide, please reach out to us. We'd be happy to mail out flyers or business cards. Our goal is to make sure that everybody has good quality health coverage, and we want to do anything we can to make sure that happens. So we want to spread the word about open enrollment. We want to make sure everybody understands the Medicaid Unwind, as Renee went over all that great information. So if anybody has a way to help us get the word out, please let us know. My contact is right here. If you email at navigator@firstchoiceservices.org. Like I said, we're more than happy to mail out some flyers. We can do special presentations. And then, of course, if you need assistance with healthcare sign up, please reach out to the Navigators, 515-978-9570. And we're glad to do whatever we can to help you through this process.
All right, so these are just Iowa-specific resources, very much tie into what both Renee and Jeremy shared in terms of what's available. So the Medicaid Unwind, Iowa specifically, red phase is once you get your renewal form in the mail, please make sure you fill it out and send it back to Iowa HHS. If you need help with your form, there is a 1-800 number that you can use. Please make sure that you are checking your mail and opening up anything that you receive from Iowa HHS in case they have other information that they need from you. And please make sure that you respond quickly to avoid delays in any of your health coverage. If you have recently found that you have lost your Medicaid or Hawkeye coverage and you're needing help finding other available options, these are the different options that you could access. There's the member services information. There's the phone numbers that you can use there. There's also your income maintenance customer service center. You can use that in order to report any changes that you have for your information. I think it was mentioned a few times before, just making sure that you have the most up-to-date information available so that you are receiving any of those email or any of those messages through the mail and you're receiving them in a timely manner. And then finally, the Hawkeye member services information as well. So just a few more information pieces. If you are trying to get ahead of a managed care organization, here are the member services specific to Iowa Total Care, Molina, and also AmeriGroup here in Iowa. Another place that you could get information or ask questions would be that Iowa Medicaid hosts town hall meetings twice a month. It takes place on the first and the third Tuesdays of the month for any members or people that serve them. It is from 4 to 5 for the first meeting or 5 to 6 for the second meeting. So that's again the first and the third Thursdays of the month. There is a link there that you can register to be part of that. There is often presentations that are being done, but there is often times at the end. Thank you so much, Renee and Jeremy, for your presentations. We greatly appreciate the time and energy that you put into it. Fantastic information. Just to let you know, if you want to have up-to-date information from Ask Resource Center, you can go ahead and like and subscribe to our YouTube channel. You can also find us on Facebook for daily tips and information. Also, if you go to the events tab at askresourcecenter.org, you're going to find all the links to future webinars. Upcoming, we have a virtual support group for families. We have youth mental health first aid, and we also have a webinar from Iowa Safe Schools coming up in November. So that's where you can find that information.